Hope Channel, changing lives.
Hi, good evening once again. Welcome to the program Wounds of the Heart, where we are here to help you heal, learn, educate ourselves for you to help you heal that emotional, psychological, that trauma thing you're going through, so that you can also help someone who also is in that situation. This evening, I'm privileged to have I'll call her my co-guest, because she has been so wonderful with me. And when the time comes for those of us who are watching for the first time, I'll introduce her to all of us to know who my guest is. Slick Africa, God bless you all the time. It has been awesome working with you from day one since I began this program. Slick Africa has been so much of a help, giving me fabrics to sew here and there. And in case you need Slick Africa, the number to call is 0557 355 852. 0557 355 852. On Instagram, it's Slick Africa. On Facebook, it's Slick Africa. Just select a fabric, and I'm telling you, you call them, they will just deliver it right at your doorstep. And you know what? Today you saw a different flyer. My Alpha Art is changing his hands. You know, Alpha Art is good in doing this graphics thing, flyers, putting you on a flyer ASAP. He doesn't waste time, and he will deliver whatever you've asked him to deliver. And if, in case you go on Facebook, Alpha Art, on Instagram, Alpha Art does underscore graphics, you just find him there. And the number to call is 0551 404 387. 0551 404 387. And Alpha Art, you can talk to him, and he will be there for you. All right, in case you want to also push this program, Wounds of the Heart, forward, you can talk to us. We're still soliciting for sponsorship, because we want to go far. We want to begin a campus tour to meet the senior high schools and the JSS people, just to begin from scratch there, because there are topics that they need to know. As we are talking now, they might be in school, they wouldn't have time to listen to us. So we want to move out from the studios sometimes to reach those people there. So if you want to partner with us, if you want to talk to us, if you want to help us, and the number is 0559 535554, 0559 535554, and Wounds of the Heart will be very privileged and happy to work with you. Today, there's this topic that growing up I misconstrue it to be something else. When we talk about autism, what it is, what are the effects? How can we know that somebody is suffering from that? Is it a psychological issue? What it is about? So today I have she has been a regular guest on this set. Helping me or helping you or helping all of us to understand one way or the other certain things that we need to understand in our homes, our offices, or wherever we find ourselves watching. In case you just joined in, the program is Wounds of the Heart, and we are live on Facebook, Hope TV GH, and also on YouTube, Hope TV GH. You can just subscribe to our page, just like the page, subscribe, share, and let people also have the zeal to watch this program. So once again, let me welcome you, my viewer, and also our guest for tonight. Good evening and welcome once again to Wounds of the Heart.
Good evening.
And I trust you're doing well.
By God's grace.
She's Justina. She's Justina. So if you're watching her for the first time, she's Justina. Today she's going to take us through what autism spectrum disorder is, what it is about, what should we know about it, and how best can we identify, and how best we be able to diagnose and even heal other people or help other people out of it. Jesse, once again, welcome.
Thank you.
So you heard my introduction to today's topic, that autism and spectrum disorder. What is autism? If I should ask that question first.
I always want to go in a low way so that everybody watching
exactly
trying to talk about. So in simple terms, I'll say that autism spectrum disorder is a range of complex neurodevelopmental disorder. And the emphasis is on disorder. Disorder means there's no treatment, there's no cure, but we manage.
So you're going to stay with the person for the rest of his life or her life?
Yes, but you manage, and then usually as you grow, it gets better because by then you've learned how to handle certain situations. So this neurodevelopmental complex disorder usually affects our social functioning and communication.
Yeah. So when you talk about a neuro, my viewers would like to know, neuro, what does that mean when you talk about a neuro functional disorder? What is?
So in simple terms, I'll say that neurons are the means by which our brain and other parts of the body communicate. So the means by which the brain communicates with other parts of the body. So they are fluids, veins, and all those things, usually in the brain through the spinal cord, and then it communicates with other. So you touch something and it's hot. It is the neurotransmitters that communicate to the brain that it's hot, you may get hurt. So you take, and it happens within a twinkle of an eye, less than a minute, some few seconds, it communicates. So you see that if you have a challenge, then you end up hurting yourself or going through unusual issues. So that mode of communication or means of communication between the brain and the other part of the body is affected. I always use something like, see that when you take a bone of the fish, it looks just like the spine, though different shape. That one is straight, but you see there are some fluid at the joint. You see there are some lines. The lines, one is big, one is small. It's similar to that of the human beings. You realize that it's linked from the head through to the other part, and then the parts of the body determine how the size and how they behave. So when these things are affected, then it impairs. So with the autism spectrum disorder, affects social functioning and communication part of a human being.
So if I can understand, probably with my viewers also, if I should step on a stone, for the system to know that I've stepped on something and it's certain, the neuro that transmits those things.
Exactly, communicates.
So which means that autism, when you're saying is a neuro disorder, which means that there's a missing link in the communication to some part of the system.
It might not be necessarily missing. It might be there but dysfunctioning. Or not functioning as it's supposed to be due to other factors that will get there. So due to certain factors, the thing is there, and you can have a light here, your switch, everything connected, but you put it on and the light isn't. So
which there's a break somewhere. There's a fault
which
somewhere.
not necessarily that the bulb is dead or something, but there could be something.
Some strains in the wire is crossing down.
So sometimes you touch it and it's on. It tells you that everything is working. Either there's the link is so loose or something. So it's similar to this one.
So it's good. Do we have fact about it? Because I earlier on said that I thought autism, it's those special kids. So, but what are some of the things we need to know about autism? What are the facts about autism?
Autism, it's a disorder on its own. Usually people think it's a psychological, mental health issue. No, it's a disorder on its own. So autism can exist without a mental health issue or without any psychological issue, or it can coexist with mental health issue. So they are different, but they can be together at the same time. Autism is 4 times common in boys or in males than in females.
Really?
Yes. And then again, from research elsewhere, in Ghana we don't have much research on such things, but in the US, for instance, it's stipulated by research that between every 54, 59 children, there's an autism case. So every 59 child, one of them will have autism. Or 54.
So when you count 60 children, at least one of them
will suffer from autism spectrum disorder.
Whoa.
And then another interesting bit is also that the signs and symptoms vary from individuals. So I may be living with autism or be autistic. You may be, but our symptoms may not be the same, even though it's the same disorder. Yeah, so those are some of the facts. So you can't compare one case to the other. You have to treat them as individuals.
Autism, if I'm suffering from autism, you're suffering, our cases will be different.
Yes.
Unlike any other disorders that you can say that, okay.
Yeah, like malaria, you suffer from cholera or malaria.
The signs and symptoms are the same.
There are a few things that should your temperature, feverish. No, it's not same with autism. Autism is particular with the individual.
So then which means that you can't prescribe an antidote for autism boy A and the same to autism boy B.
Yes.
Because they have different.
Yes.
Whoa. So
and
well,
the type also counts.
The type of, so autism, we have types of autism.
Yeah, we have about 4 types.
And what are they?
So we have those that comes with learning impairment. Then we have that affect communication. That's with learning. I've said that already. That's with behavioral issues. So those people, you see them becoming restricted to certain behaviors. So these are the types. So if it's in the communication side,
I know we'll go there, but so now so what are the difference between special children and autism? Because me, mom, when I was growing up, and still the special schools, I thought all of them are autistic children. What are the difference?
So you see that, like I said earlier, autism usually affects our social functioning and communication. Regardless of the type, these are the basics.
Okay, it affects what?
Social functioning
and communication.
Okay,
all right.
So that's it. It can coexist with other mental health issues or not. But the other special children you're talking about, it could be cerebral palsy, it could be Down syndrome, and they also come with different, usually most of these are mental health or physically challenged in a way, somehow both. So which is different, because with the autistic ones, they live normal life, they look normal. It is only with their expression and functioning that you get to know. For instance, with social functioning, you see that they respond to social cues differently. So where you were expecting a child to smile and it's not coming, because of how their system runs. And when it is communication, either they are used to one way of communicating or suffer from the back and forth normal communication patterns. So I say hello and I'm expecting you to say, respond in a certain way, but you say hello and the child is looking elsewhere, or they pay attention to watching particular direction. So as I chat with you, you see that my eyes go back and forth. I watch the camera a little, watch you a little, turn around. But with them, if I'm looking at you, I'm looking at you and nothing else. For a period. So all these things are. And then another thing I must let everybody watching this program to note is also that between the period of 12 months to 3 years. I
wanted even to ask you how do we come about the science, but after you started.
Yeah, this is the period the obvious signs start to show between 12 months and then 3 years. And the reason is simple. At the time they've started to get communication skills, understand to a level how we interact. You know, as a baby, when you touch a baby, the baby responds in a certain way. After 3 months, it gets better or it differs in that order. So in the toddling stage, you expect certain behaviors. So you expect a child to be able to differentiate between mom and dad, where every man becomes a dad, every woman becomes a mom. Okay, after some period, though we have late developers and then fast developers, but it follows the same pattern. So after some time, the child is able to differentiate between the dad from other men. So all these things are
stages,
signs.
okay.
And then again, you expect that somebody who is closer to this child, when they have certain things they do and the child responds, either a smile, a touch, a certain way. And you know, babies react when they know. Even you leave a baby in a sofa on the TV, when a human being comes in, the baby reacts in a certain way to let you know that yes, there's a human being there. So all these things are signs, and it starts from that period. Again, eye contact. In communication, we call them tactiles. The non-verbal cues. Yes, so you see a baby to respond, turn the eye to look at a sound direction and all those things. And at that age, it's missing. You should be concerned.
You are bringing certain things up that probably our mothers are aware. You see, when you give birth to your first child, they will ask you, after a period of weeks, is it blinking an eye? Is it doing this? Is it doing that? If the child is not doing them, I don't know, they will probably apply herbal things to do. But from what you are saying and from what research has brought out is, it may be signs of autism if it's the other way. Fine, you give birth to your child, and 6 months, 12 months, there are things that the child needs to do, and the child is not doing them. There's a problem.
It might not necessarily be autism, but
there's a problem. There's a problem. That's why I said there's a problem. But bringing it to autism, when a child at that time, 12 months, can't communicate well, recognize the real mom or the real father,
function socially. So you see, some children, when strangers touches them, they cry in a certain way for you to know that they don't like the arms they've fallen in. All those things are communication. Some autistic children try to cry out because they can't use other means
to talk.
Yeah, so it's all about screaming and crying. Whilst other child can show the arm, trying to let you know that maybe there's pain or there's something. I have this boy, whenever he steps into muddy area or something, then he will turn the feet like he doesn't want the feet to touch the ground, meaning either they've stepped into something or something is pain, or they wear tight shoes and they don't want to walk in a certain way. These kids normally can't express that, so they result in screaming and crying. So all those things should be concerned to you. And then the usual talking. So you say hello, expecting this one, and it goes the opposite, or it didn't come at all. You should ask yourself why. But you touch babies in a certain way and they respond. Even if they are sleeping, you touch them and they lift. You know, all these things are signs that there's something. Even the eyeball. You see, the black and white eye keeps changing as we age. And then at certain months, the black becomes more darker, or it goes. So all these things are.
How do we just see? How do we? It takes education to understand certain things that we wouldn't rush our children to the herbalist or probably to the Osofo to pray for. This program is designed to educate, to help, and to heal anything that has been a trauma. Because if you have an issue like that and you can't do away with it, it stays with you forever. And whenever you see your child, whenever you see that baby, you sometimes regret of giving birth to somebody like that. it is staying with us. So mothers and parents, especially our mothers, because fathers always leave home for women to take care of their children. But hey, Gina, Justin, there's something that probably just came up. You know, now because of career, our kids are sent to toddlers school at the age of 6 months, crèche at the age of 6 months. A mother goes to work in the morning, father goes to work in the morning, come back home in the evening. Sometimes probably they will get there, the kids are asleep already. The babies are asleep already. How then can parent, and even sometimes when it comes to weighing stuff like that, they allow somebody to take their words there. So Justy, as you are telling us now, probably there's somebody watching us who has a newborn baby, 6, 7, 12 months. With this social thing you are saying, what are the things that they need to focus on and be watching their child go through? What are the stages? What you are saying? I want you to take us through. Yes, please. I'm
passionate about the question you're asking because what I usually say is that, do you eat? Do you sleep? Do you use social media? Then, as a parent, you have to set up. Do you even go to church? I'm not against churchism or going to church or being religious or whatever. But my point is, if you need time to be with your child and for whatever reason you are not getting, sacrifice that period of church for that. And it's worth it. Because God will not ask you how many church services you attended, but you'll be questioning about that gift
that was given to you.
That was given. How did you take care of it? So if you social media and all those things, then you have to wise up. You pick your child from the crèche and you notice there's unusual crying or even the diaper. When the diaper is wet to a certain level, children, regardless of who their months and their age, will react. Is your child reacting that way? When you are going for your child, how does he receive you? Is that child able to differentiate between mommy, daddy,
and somebody else?
Yes, and the teacher. You see, that difference because parents have certain bond with babies, even the way we carry them.
Yeah,
it's not the same when others are. So in that in the Ghanaian traditional setting, when you carry a baby, somebody can tell whether you've given birth before or not.
Yes.
The way you carry the baby. So all those things matters. So when you touch your baby, how does he respond? Fathers may be busy. I sometimes say that it's an excuse. But when you get home, what are the things you do with your baby? That should be a routine. You see how dogs behave. I have a dog. I didn't raise that dog. I met a dog some months old, but just out of pity, I decided to feed the dog. And the dog has gotten to know me to such a extent that I pick a car and this dog will follow me. There was a day the driver said, "Madam, when the dog will say, when we get into the highway and he can't find me, you go back home." Now I realize they know the time I get home. So sometimes I meet them at the junction. I'll get there and they are there. The moment they see me, they follow. Take the lead, and they will behave like we are bodies, you know. So what about your child? If a dog is behaving this way, what about your child? And if you're making all this effort toiling in the name of taking good care of them, what is good care if you don't know your child or your child doesn't know you? So I think that 5 minutes to stay on social media can be used regardless of whether the child is sleeping or not. Do something. Let that child know that he is at home. Mommy is at home. Then you see the response. Sometimes let's eat together. I know some people don't like baby's food, but play with it. So when they start eating, you see that is the child able to hold the spoon or whatever well. Is the child able to differentiate between the left to right their bowls? I have this little boy whom I used to keep, and then the little one got to know that there's a particular bowl I serve him with lunch or something, but when it's breakfast, it's different. So I noticed that anytime I pick that bowl, that boy will ask of his spoon meaning my food is ready. So as soon as I'm with that bowl, he will entertain my spoon.
Of course, that is his bowl.
That is his bowl. So these are some of the things. So if it's not coming, or sometimes it drops, they can't build it. So once they learn new one, the old one drops. All those things are signs.
In case you just joined, we are discussing autism, and we are still talking about the signs and as to how a parent or a mother will know that your baby is well okay, or there's something wrong with the baby. If you have questions and contribution, you can just put on our WhatsApp platform 0559 680066, 0559 680066, or on our Facebook handle. You can Hope TVGH. You can send your comment and your question there. We'll have time to read for you. Let me read a few people's comment on Facebook then, to also recommend they are watching. There's a Derek Opoku watching you live from Bibiani. Derek, God bless you from watching us live from Bibiani. Derek, God bless you. Mommy's boy Focus. He said, God bless you, Pastor, watching live from Dansuman, Sahara. Mommy's boy. Well, that's a nice name there, Mommy's boy. All right, God bless you for your comment also. God bless you. And also from James watching for Joe, other Dr. GB for Joe. And I know one day we meet. I always say one day we meet. He said, Penkwase SDH Sunyane, watching live from Sunyane and enjoying every bit of the discussion. Thank you very much, and may God continue to bless you. And God continue to also bless you for every blessed Wednesday, the comments that you post on my program. God bless you. And I know one day we'll meet. Meshbon Rao Bamfo, I know the boy is fine. Very serious issue, Atlanta, Georgia. Meshbon, God bless you. I know the boy is kicking. I know the second one is about. Thank you for the comment. So back to the question. Now you said we have types of signs and symptoms to watch. So what we were talking about is the social life, the way the child is growing. From 6 months, 12 months, there are some certain things the boy or that girl should start doing. If the girl child is not doing them, then which means that the parent we should take serious notice about that. When it comes to communication skills, what should we expect? What are the signs? If it goes that way, what shows that what the boy is exhibiting or the girl is exhibiting is an autism spectrum disorder?
Okay, so early signs may include language, delay in learning language skills. So some cases takes time before they can speak. Some it's normal. They are just slow developers. Some too is concern. Some they cannot pronounce certain common words that at the stage they should be able to. So all those things are concern of concern. Then there's usual, I said, the communication patterns.
Exactly.
So the common example I can give, I believe in practicalizing.
Exactly. Okay, let's do it.
So you get to a house and you meet a toddler sitting on the ground. They can't speak, but you say hello and the child does something. Sometimes you speak and the child responds, not necessarily
responding to the word, but then there's a gesture or something.
Yes, or you could see, or sometimes children talk. For instance, you know, I work at the hospital, so they give injection to a child, and you could see the child as young as that.
Exactly, that's the months, the early months.
So indirectly, you get to know that the child has something to say.
Exactly.
Just that they don't have the word. So all these things are. So you say hello, and you expect something. How are you? Where's mommy? Even though they can't respond, but they behave in certain ways that you know that they are responding. And then the non-verbal cues, and the most common is eye contact. Eye contact. The child cannot respond to eye contact or give it to you. It's a concern. Or like I said earlier, they focus on one thing and does it. So I'll mix them up.
No problem.
So with the behavior, so you see that they are particular about certain behavior. They are used to, or they repeat certain actions. And they are so routine. Very, very few. Tell them to put their shoes here. Dare not change the position. They will have issues with you. So these are you notice that your child always leave the shoe here, whether it's good or not. or play in a certain way. So if it is this bottle that the child plays with, always that is it. You know that as they grow, even if it's the same bottle, they play with it in different ways. So sometimes you see them singing, they're singing into the bottle, speaking into or using the bottle, but this one is a particular direction. And all these things are cause for concern.
Let what you in the communication thing, in as much as they can't speak or whatever, a child will go to school at that tender age, and there are questions that you expect every child to answer. For instance, when it is I, they will say you, like you. They instead of saying, and instead of a parent getting curious about it, like why is it that this child is behaving that way? What bond kind of, because we don't know that autism has this trait that we need to think about or check when our younger ones are going through. So when we see parents see such signs, we need not to all the time spank our kids or children, but rather we need to question that thing that the child is doing, because it's not normal for probably your child to start early school and 2-3 years. There are basic things that everyone needs to know, 1, 2, 3, and your child can't say one when he has been told one or she has been told one. When it happens like that, what should we, the parent, do?
Okay. Thank you so much. I will not limit it to parents,
caregivers or teachers or whatever. Yeah.
Teachers they are trained to know some of these, but sometimes the pressure and the facilities not the way it's supposed to be makes it difficult for them, and the number of students in a class makes it difficult for some teachers to identify some of these things. But I always say that in taking care or educating young ones takes 3 group of or 3 category of people to come together to do it. That's the parents, the government, the society, and then teachers. So none of these can be taken away. So all that I'm trying to say is, you take your child to school 6 months, okay? You don't have the time or you don't have the knowledge to observe certain things. Ask the teacher or the caregivers, how is my child behaving in class? And listen, don't be so, some parents are so sure of their children, and whatever others say is a no. Your child might behave differently towards you and differently towards others. So sometimes you have to listen. And then you question, why is my child not doing this or not able to? What can I do? And again, it's not always learning impairment. The impairment comes, sometimes it declines. So they used to know 1, 2, 3 up to 5. Now seems they can't remember. It
should go up instead of 1 to 10.
Yes, it's declining. It's also a factor. And then again, you should ask more questions when we visit the health sectors. And then I also plead with the community health practitioners, especially the child welfare. When parents bring their child for weighing, you should give them time to ask questions. You should be their friend. Sometimes the way they talk to them makes it difficult for parents to ask questions, yet they can't complain. Then sometimes you should involve other health professionals. I know it's a difficult thing to talk about in Ghana because we see health to be doctors, nurses. But believe me, even the cleaner and the hospital matters when it comes to healthcare. So let's include the psychologists, the psychiatrists. We should know when to. When a doctor you are not convinced, there's nothing wrong seeking the advice of those specialties. There's nothing wrong. It helps us to understand. After all, if you go through and then it isn't that, there's nothing wrong with it. Because with autism, when it's diagnosed early, it's better. The earlier it's diagnosed, the better for the family, the child, and everybody involved. So we have to pay attention to those things. And then my pastors, it isn't everything that is, You see, I'm finding it difficult to say it.
No, say it. We need
church
to.
members trust you. So I'm saying church leaders and pastors should learn such that they can help educate parents with such situation to seek the proper help. I am not against churchism. I'm not against prayers. I am a believer and I believe in prayers. But I believe in the holistic approach to everything.
Exactly.
So I need a medical doctor, I need a psychologist, I need a psychiatrist, I need a nurse. Even the nurses, they have specialties. I need a midwife and all those people. Then prayer comes in. But you don't leave all these things and then settle on prayer, because they are, like I said, this is a disorder. You can't change, you can only manage. So if you stop all these things and you keep praying, there is something you have to do. That is why God has given us, I mean, except for the lack of knowledge, which means we need knowledge. How do we get knowledge? You have to learn. So once you learn and you support it with prayers, then it works. But when you stick to one, and then the Bible says, let my people go. Why didn't he
forcefully snatch them or something?
Use the miraculous way to move them. It means make a step. Let's look at the guy, the blind man at the water.
The blind man, Bartimaeus meeting Christ Jesus. The crippled one was
by the water. Yes, both of them. You see, the blind man, he said, go and wash.
Okay.
I feel like it wasn't that. It was done before
by
he
faith,
moved.
Take a step.
But the step will confirm it. So you are blind seated at one place. If you don't move, how would you even know that something has changed? So being obedient and making a move. That's what I think it is. And then the cripple, get into the water. It isn't the water that did the miracle, but being obedient and taking an action. So you don't sit and wait for it to be. I always use the manna too. Manna fell and it didn't fall into people's mouth. You have to move and pick.
And there were instructions that
you can
take,
you can pick and it's in your hands. You'll still be hungry. So once you pick, you put it in your mouth. Then it gets into the system. So it's the same with our health system and then the way we think about health.
So Shelley Adi says educative program. God bless you. God bless you, Shelley, for your comment. So if I got her right, with all these things that we said, what I deduced this few point before we enter into the causes and how best we're going to help. I deduced this 6 point. So if my baby or your baby at probably 6 months to 1 year can't smile or show up some smiley or facial connection, please let's check it well. If he can't imitate whether this is the father, this is the mother, this is the difference between 6 to 12 months, there's a problem. Let's check it well. If a baby after 12 months, a year, can't even bubble or talk or say anything and he's moody, please don't put certain things on the neck or the hand and say that it is you had a dream and somebody is no. Let's make them move that steps that she said, and there should be gestures. There should be gestures, as she said. That the child even playing with a toy shouldn't play with a toy, one toy the same time, the same way. There should be different ways in which the child should play with a toy, so that you, the mother or the parent or the teacher, will know that the child has something, he or she is growing. Especially, she made a point that I want us to reiterate. You see, when your child begins to learn 1 to 5, 5 to 10, every child growing up, I carry Fifi. When we are climbing the steps, I'll use the steps before he got even one. We use the steps to climb 1, 2, 3. So he learned to count 1 to 10 using the steps. Now, if Fifi can't count from 1 to 10, there's a problem. But now he has graduated to 1 to 20. Although from teen is a problem. But if from what we are learning today, if he reduced or if there's a retrogression, that I think my child has a problem.
And again, over time, the child will be able to tell that it takes how many steps to get to the goal. It's something that we are all at fault in that. Those who have all the 5 senses working, we don't pay attention to these things. I learned this from a blind friend at Legon. from Legon Hall, he knows the number of steps that will take him to the BAM library.
Okay.
That will take him from Legon Hall to the roadside.
Whoa.
That's the main gate. That will take him from the main gate to the BAM library. That will take him from the main gate to the Legon Hall, his room. He's blind. So I noticed that he counts as he walks.
Exactly.
So if it is more, there's something.
There's something wrong.
So once I was with him, and then I stopped to talk to somebody without excusing. He said, but we haven't gotten there. Why are you taking me? You see,
you might say the draw or something.
But I noticed, and in fact, I really learned from him because he could tell when it's not safe for him to cross the road to Commercial Bank, Lagos. So he would tell you, I want to go to the bank, but this time it's not good. So I got to the gate and I have to come back. And he's walking all alone. It's the same with the autistic children. So as he did it, he wasn't born at Legon. He just joined Legon
in school when he was of age. Yeah.
And he knows when somebody didn't write well. Say you.
How did you know?
You see, but he knows. And then so if a child is not able to over time after counting for a period, cannot tell how many steps will take me to the hall, how many steps will take. No, it's an issue.
Then finally,
like I said, it might not necessarily be autism.
No,
it could be other developmental issues.
That is why I always use problem. I wouldn't use autism. I always use problem because, according to research, when you're at 24 months, 2 years probably, right? If your child can't use 2 phrases to talk, there's a problem. Parent, God has given us the knowledge to be educated, to educate ourselves, to also learn certain things. And it be for us to say that, okay, it is in our family, and my father, my aunt, my cousin also, when I learned that when he was growing, after 2 years, he began to talk. Please, it is not like that. Let's try as much as possible to understand our kids and children as they are growing up, so that whenever there are changes, we can identify and seek help. As you're saying, what can be the causes? What can be the causes of this autism thing we are talking about?
Okay, let me drag you a little bit.
Oh, no problem, Mami.
I want to emphasize on the types.
Okay.
There's one that comes with or without intellectual impairment.
Okay.
That is one. Then one with or without language impairment. Then one associated with known or unknown medical or genetic or environmental conditions or factors. Yeah, and then we have the other that is associated with neurodevelopmental, mental and behavioral issues. With the catatonia, it's a specific mental health issue. Yeah, and then we have one that can that can be diagnosed with more or other
way factors are leading
mental health issues and medical or combined. Yeah, but research hasn't for now. We don't know what exactly is the cause. But you know, basically genes play a role in everything that we do. So genetics. That thing called genes.
And somebody, when I was reading, somebody wrote that sometimes it depends on what parent, mothers especially, the intake of medicine when during pregnancy, things that the woman or the pregnant lady will be doing when she is pregnant. Can that be a factor? Can that be a cause of autism? Because in as much as we don't know what really caused it, if should a pregnant woman go to the pharmacy to buy medicines unprescribedly? Okay,
so like I said, we have the genes. Having immediate family member who has suffered it, the possibility of having it. Then we have the environmental factors. That is where what you're talking about comes in. Sometimes things that we do before we take seed. You see, when it comes to pregnancy, don't think about it because nobody knew the exact day pregnancy took place. But things, lifestyle before even we get pregnant, that is with both the one giving the egg and the soil we are planting the seed on, both it's important. So it's not about necessarily mothers. Of course, mothers play a role, much done. But if the seed have an issue, regardless of the mothers, the land it falls on, there will be issue. So we should all be concerned about that. And then again, exposure to certain toxins in the environment, like heavy metals. How would I even the common way to get heavy metal is I'm not saying don't use it, but like blending. When we blend, when we use the corn meal, you see, nesano, so I'm not saying. So look at your blender very well. You see that the blade is reducing. Even the knife, you see that over time. Is it a knife?
So knife we sharpen. We can use the stone to sharpen the knife. Then we say that it reduces, or we will use it to do. We give it to people who sharpen it. But I'm emphatic on the blender, even the silver the silver the silver sponge.
And then using silver ladle in. So that's what
it shrinks with time.
So see your ladle. The big spoon.
So the wooden one will be fine.
That is what we encourage. But how many still get?
Oh, then I'll get some for my wife.
Okay. So using silver against silver scratches and then keep both the saucepan is producing and then. So when you use wood against the silver,
it is fine.
Some use plastic, but you know plastic also comes with its own issues. And so the wood is that we have bamboo. You can
please,
make
we are not advertising for any company yet, but I think
you yourself can go to my hometown. You yourself can have the bamboo and then use the knife.
People will say but there are special ones that when you can go out. It is better. Mothers, let's get some for our wives to use for our own health issues. Because what you're saying is apotoria, the earthworm, is it bowl. See the number of times we apply the original portobello, the one that has the clay tin, the original one, not the one that they are spraying inside, but the original one. In as much as we grind, it shrinks. And I ask myself, where does it go? And I see it the tea.
But the tea is healthy.
Exactly.
At worst, it's worms that you make, but the process that the Ayuwa goes through. Can never stay there. Lever cannot. Even look at the tapoli. It's wood, so it gets to the system and it decays and it comes.
Sometimes you buy food or you even eating at home and you see that metal sponge slide. So then sometimes
it makes me believe in God, as in said. Things that we don't see, or things that when we see, it would put fear in us. He takes it away. So I asked myself, how come you were able to notice that hair, that silver thing in the food? But all of a sudden you spot it and you take it out.
In fact, we are learning. Justy, sometimes we are the causes of issues that.
We blast. I don't know what is wrong with that. So because it seems say any being trust so say over civilized. I don't know, because we use our own apotoiwa for the pepper, raw pepper, and all of a sudden that one we don't want it again. I don't know. So even pepper that we use.
Apotoia to grind.
Yes, we want to go blender and
so then we blend everything.
What is wrong with us?
We want the fast now. Now it's remote.
That's why we are dying fast, you know. Yeah, simple as
so before we go for preventive measures, what are the risk factors when it comes to autism?
Yeah, it's the genetics, as I've said. Environmental issues, genetic mutation. We have something we call Fragile X syndrome. That's a bit scientific. And then, you know, human beings are made up of chromosomes. And then so there's one X that is fragile. And when that fragility is there, you have some of these disorders. And then born by older parents.
Okay, I wanted to even ask that one. Because
when, especially both parents are grown. But you see, when one is old, especially the man is old and the woman is young, it balances. But when both are older, it can create some of these issues. And then low birth weight. Children that are born with, due to certain circumstances. all those things can cause, and then metabolic imbalance. These are very scientific, and then but how our body breaks down
to certain things.
Yeah, sometimes it's the rate at which it doesn't go that way. So those imbalances, and then exposure to, I've said it already, exposure to heavy metals and environmental toxins. Let me emphasize on environmental toxins.
Okay.
We burn in Ghana. We burn anything, anywhere, anytime. You wake up in the morning where you have to enjoy the fresh air, then somebody is burning something plastic. In the middle of the city, somebody is burning something. So all these things that we are burning and we are inhaling, the plastics, they're all stuff. Some people burning Thai because they want the metal in it. Because of someone's interest, all of us are suffering. So we should be particular about it. It's not today.
No, then what of the industrial areas? We are not supposed to.
That is why
to residents around.
That is why industrial area is industrial area. So why are we living there today?
But say, as I say, so
it's not everywhere that we build domestic or residential whatever. But in Ghana, we seems we don't care. So there's a place around somewhere I know, and I think there are 2 plots. One have a story building, and the other is digging, winning the rocks. And the issue is that's my land. But you could see that what he's doing is causing the foundations of that story building. What kind of inhuman have we become? What is happening?
So aside the risk factors, what are the complications when it comes to?
It's basic. There's social functioning, and then the communication issues. But aside all these things, these are the key issues. But some children can grow normal.
Exactly, that is a good point.
Depending on their severity, and the early detection or diagnosis, and then following proper treatment plan. So if you're able to do all these things, your child can grow
So
normal.
with a child that is suffering from early stages of knowing and identify object, definitely is going to affect the person in school for some time. Definitely, if care is not given.
Depending on the type that is profound.
Profound in the type of autism.
The intellectual impairment,
issue.
Then school thing. But you see, like I said, there's always something they can do better.
Exactly.
So then you focus there.
But how can we Ghanaian parents focus on something? Because you see, we are living in this part of the world where if your child gets all A's, they also call a medical doctor straight. There's no one who will sit anywhere.
Even if he doesn't like blood or he doesn't.
No. I also call a doctor. Hey, all A's. Not by super called visual art. Okay, fine art. And now what? No, you need to do medical doctor. You see, and that is the problem with us. And we know that there are a lot of medical doctors whose passion is not what they are. They just do it because
their parents
says.
So that is what you see, it boils back to our educational system. Somebody must enlighten somebody. And are we doing that? Okay. Some teachers select courses for people because they are doing well. Yes, but what are their interests?
What are the interests?
What are the skills they have? So we have to pay attention to all those things. And then again, parents don't see yourself in your child because your child is different. The combination that brought you isn't the same.
Even the time that you were produced wasn't the same time.
So don't force your failed ambitions on your wards. I wanted to be a doctor, and for whatever reason I couldn't, so my child should be. No, sometimes let's look at for what the children love to do, because whatever you do with passion, you end up doing it well.
That's wonderful.
You end up doing
exactly. You don't get stressed. You don't get tired.
Because you enjoy.
Exactly.
Even if it is carrying heavy stuff, because you enjoy doing it, you don't feel the pain attached with it.
Exactly.
So that is how it is. So sometimes let's seek help. Let's seek help. When we go to the hospital, let's question. And this I'm pleading, health workers, come down to the level of your patients. Give them time. Don't put fear in them. I'm the doctor and I'm saying this. No. you listen, even if it doesn't make sense, you listen, because sometimes just listening to people help them come out with the exact issue, and then let's try all other options. So with autism, we have depending on the prevalent condition, we have the talk therapy, speech therapy, physical.
And that's what I said. How do we the treatment? How do we diagnose in a minute or two? Because our time is up. I don't want us to come back on this topic. A minute or two. You've started already, so please continue.
Yeah. So we have the talk therapy, speech therapy, physical therapy. Then we have the medical side of it, but treat it holistically. So discuss things with doctors, the psychiatry side, the psychology side, medical side, and then the physical aspect. So diet also play a role.
Exactly.
Such children must eat a lot of fresh vegetables and fruits.
Exactly.
And then
junk food out.
Junk food are out. And then timing, the timing in which they eat. You must be concerned, and then you have to help them go through their process, exercising. So sometimes you make it like a routine, and they are the routine type, so they enjoy. But you have to modulate it for them so that they will change and then get better with that.
So with your last words on autism spectrum disorder. Today it's very educative. We are educating ourselves about certain things we are ignorant, or we don't even give an eye to that. And today we've learned a lot. I know that the one who is pregnant, or the one who just gave birth, or the one who is having some months-old baby will start applying whatever we have said to make sure that is your baby doing well, or if there's something wrong with the baby. If you see any signs that please don't sit down, quickly go to the hospital or see the doctor to talk about him. Mama Majesty, any last words when it comes to this?
All that I would say is be very observant as a parent, and then again talk. Don't keep things to yourself. When you have a child with such symptoms, don't be scared. Just talk to your medical doctor. Ask him or her how best you can help, because when you start early, it gets better. When you notice is the speech, then you get a speech therapy. If you don't know how to get it, get to the hospital, any public facility, and ask, okay, my child isn't able to talk as expected, what can I do? Then let them help you. Our health professionals, let's not be the warehouse of all knowledge. Let's understand that we also have shortfalls. We have other professionals who are trained in specific issues that they handle. Let's respect ourselves as health professionals so that we can help our patients or clients holistically, whilst we support all these things with prayers.
Thank you so much. Whilst we support all these things with prayer, without prayer, Christian, you can't live. In as much as we get the antidote, prayers also work. Let's deal with it holistically. We shouldn't put fears and trauma in families who are experiencing this as their kids, their children are born. Just to God bless you. Slick Afraid, God bless you once again for your fabric. It's there out there. Please, Instagram Slick Afraid, Facebook Slick Afraid. Please just call them, and they will just deliver it at your doorstep with something small. You need to look of you pay on for delivery fee. And Alpha Art, God bless you for giving a twist to the flyer. And in case you need him for a design, for anything, he's there. Please, 0551404387. He's there. And you, yes, those who shared your comment on Facebook, please, God bless you for that. It tells me that people are watching, and those of us who watch the repeat, we are learning together. We are all learning together, and let's help this program. I said that we want to move out. We want to move out to the senior high schools. We want to move out to the JSS just to have a chat with them. We want to move out into the institutions to sit down and discuss such issues with them. If you want to help out on that aspect, 0559-535554, 0559-535554. Please call us and we will have a talk with you. And if you can also lead Wounds of the Heart to a place that we can seek a good sponsorship, please do so. You can use the same line, call us, and we will have time with you. And this moment, and Seventh-day Adventist Church, this moment are camp meetings, spiritual upliftment. Please, wherever you are and there's a camp meeting, please don't exempt yourself. Please please, let's get together virtually, physically. Let's get together and pray. This season, you know, Papa, COVID has come, and in as much as you want to go there to meet the Lord, please let's adhere to all protocols so that none of us will come back with sickness or something else, but we'll come back feeling fine and feeling healthy. Mami Justina, God bless you, and God bless whoever was with us throughout the program. And until we come your way next week, Wednesday, I've been your regular host, and the name is Pastor Abedi Bidiaba Ahmad.